samahan na ulit to. So if ikaw ay isang PT or OT na nagpa-practice here in the Philippines or in another country, then maybe this video is for you. So if ikaw ay first-time viewer din dito, you can click the subscribe and the bell button in my YouTube channel so that you can see more health professional related content. Alright? So, ang ating pag-uusapan today is what is EBP or evidence-based practice at bakit siya importante for you as a health professional to know this skill whether you're practicing here in the country or in another country. Alright? So, roll intro. Alright, so ano nga ba itong EBP na ito? EBP stands for evidence-based practice, okay? In other professions, this is also called your evidence-based healthcare or evidence-based medicine. Okay, so ngayon, ano ba yung definition ng EBP na to? At bakit parang ang dami-daming sinasabi na dapat nag-EBP ka? Ano ba tong EBP na ito? So, according dito, nung babasahin ko, medyo mahaba kasi siya. EBP stands for the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of the individual patient. Ibig sabihin po nito ay ginagamit ninyo ang ating current na mga research papers, the current published papers para i-integrate kung ano yung best na treatment or assessment na ginagawa ninyo para sa inyong clinical patients. Okay, so basically, merong tatlong parts kasi yung EBP, okay? Kailangan na i-integrate mo, unang-una is your professional experience, your clinical experience, what you found works for your patients, for your setting, so dapat yun, na i-integrate mo yun. At yung pangalawa naman ay current evidence, okay? These are the research published, the current evidence that are used in your practice, kung ano yung nag-work, hindi nag-work, okay? And the third one is, of course, the patient's preference. Ano ba yung gumagana para sa pasyente? Ano yung afford ng pasyente? Ano yung choice na gustong gawin ng pasyente? So, you have to consider all of those three things when you're thinking about the best treatment, the best intervention na ginagawa mo para, of course, sa pasyente mo. So, yung part talaga na tinuturo sa mga different schools no, na hindi tinuturo before. Paano ba ginagawa yung EBP? Specifically, yung current evidence na part doon. Basically, what you're doing there is you are being trained or tinuturo ito paano maghanap ng iba't ibang research papers, paano pumili kung ano yung applicable sa setting mo, at paano i-criticize yung paper kung ito ba ay good, maganda ba yung methodology niya, wala ba siyang mga biases or kaunti lang yung mga biases niya, and how this applies in your practice. So actually, sa ibang bansa, no, yung evidence-based practice is actually very well developed, pero dito sa Pilipinas, hindi pa siya ganun ka-well practiced, hindi pa ganun kadami yung marunong din gumawa ng EBP. So it's a relatively new practice here in our country in the field of healthcare. And actually, the reason why na hindi masyadong napapractice yung evidence-based practice dito sa ating bansa is because, unang-una, there are very limited people who know how to do it. There are very limited health professionals who are actually trained to do evidence-based practice. At syempre, kung meron mang marunong, madami sa kanila pumupunta din ng abroad to work there. Yung pangalawang reason why EBP is not practiced here in the country is because it is very time-consuming. Siyempre, maghahanap ka pa ng iba't ibang research paper on top of the clinical practice, giving actual care to individual patients. So, talagang time-consuming siya. So, yung mga clinicians, parang wag na lang, di ba? Wag na, wala na akong oras, wala na akong pahinga kung gagawin ko pa yan. Yung pangatlong reason is because you need to have a good grasp of research for you to actually perform EBP very well. You have to understand ano yung mga iba't ibang research designs, ano yung iba't ibang mga statistical tools na ginagamit, paano yung iba't ibang mga sampling na ginagamit sa mga research papers para nakikita mo kung gaano kaganda yung paggawa ng isang research paper at paano ito mag-a-apply ngayon sa setting mo. But of course, then again, it doesn't mean na hindi na dapat natin ginagawa yung evidence-based practice because of these reasons. Siyempre, we need to always strive to improve our practice na kung ano yung tinuro 20 years ago, yun pa rin yung gagawin natin. Hindi dapat ganon. Our practice has to evolve with the times. It has to evolve on what is known, kung ano talaga yung nagwo-work. Kasi in the end, we are here to serve our patients. Kasi wala naman tayong profession in the first place. Kung wala yung pasyente natin, we wouldn't be here in our profession if there was no need for healthcare or health services in the first place. Alright, so for me, ano ba yung mga reason kung bakit dapat ikaw as a health professional, dapat dapat marunong ka mag-EBP. Okay? The first reason bakit kailangan marunong ka is because you need to know what works and what doesn't work. Syempre, yung ating practice, hindi naman kasi all the time that what is being taught theoretically or has a theoretical backing, it doesn't automatically translate that it will be effective for your patient, that it is automatically okay to use that certain assessment tool. Kaya kailangan gumagawa ng EBP para malaman natin ano nga ba talaga yung mas gumagana. Which intervention is really more effective, works for this kind of population for our patients. Kaya dapat alam mo paano mag-EBP. The second reason is because your patient deserves to be treated. Andito ka para pagalingin yung pasyente mo. They are there. They are giving their money, their time, their effort because they are hopeful that you will help improve their quality of life, their condition. So kung naglolokohan lang kayo, gumagawa ka ng treatment na hindi naman talaga effective, that is already obsolete, what is the point of your patient paying you 500 to 1,500 pesos per treatment? Diba? Sayang yung binabayad ng pasyente nyo kung hindi naman talaga gumagana yung ginagawa ninyo. And the third reason why I believe we should know how to do EBP is for autonomy. So ako, naniniwala ako that we as healthcare professionals, as PTs, we should be the ones to do the actual clinical thinking, the clinical decision on what treatment we are going to give our patients. So madami ako kasing nakikilalang PT, kasi hindi naman ako nakaka-practice ng autonomy sa bansa. Kasi doon, meron akong mas may freedom, I'm more independent in my practice. Pero that's exactly the point. If we want to be able to push autonomy here in our country, we have to show our politicians, the people in power, our patients, people in our community, in the scientific community, that we are actually very, very good. That we know how to do things evidence-based. Hindi yung makaluma yung ginagawa natin. We have to show them that we are good, that we are really good, and we know how to look for evidence in treating our patients. If we want our laws to change for our profession, dapat ito yung ating mas pinapractice. So that's it, guys. If you found this helpful, you can like, comment, and share this video, and click subscribe if you want to see more videos from my channel. Somewhere I'll be putting them somewhere up here in the videos for more content. And if you are actually interested, I will be checking kung gusto nyo mag-evidence-based search if a certain treatment is effective for you guys or not. I will actually be releasing content na mga different kinds of interventions that work or don't work. So you can comment there kung ano yung gusto nyo i-search ko so that you can use it in your practice. Kung anong intervention yung feeling nyo nakakaduda, kung talagang gumagana ba siya or hindi. So I will be doing the actual evidence-based search for you guys. Just comment there. I will be choosing a comment and featuring it in my next video. Hopefully, this will be helpful for your practice.